Hi, I'm Margot. I'm a Neuro ICU nurse. I've been in the Neuro ICU for 8 months. I'm originally from Boston, but I just moved down to Tennessee. It's been a whirlwind. I mean, as you might have noticed, but there's really never a dull moment in the ICU. And the thing about neuro is every patient, even if they have a similar injury, is different, and that's why I love it. But that's what was also challenging about it, because the brain is just so vast and there's so many just intricacies and aspects to know and to learn, and you just never stop learning. But then also with all that, the new grad experience of in the ICU is just so there's so much content to take in, and every single day when you're a nurse or when you're at work for 12 hours, you have to take in all this stuff and try and make sense of it and remember it all and talk to families, and all of that is just, it's crazy, but it gets easier every day, and the more you learn and the more you invest in it too. So I'll take, on days off, I'll listen to podcasts, or take my dog for a walk, and it definitely helps on that regard. And I'll ask the more senior nurses. One of the best advice I got from a senior nurse on my floor was, she was precepting me, and I was like, what do you think what do you think I should do to be the best I can be? I want to learn the most. I want to be the best I can be. And she said, pick the nurses that you like how they work, and see what they do, and see why they're good at what they're doing, and then do that. And that stuck with me. There's definitely camaraderie. I feel like you can feel that on two different sides. I think that part of the new grad experience is extremely isolating, and it's almost something that you don't expect. And there is I do feel like in healthcare there is sort of that you have to prove yourself stigma / attitude that's sort of there, and I think that it's getting much better. But then also on the flip, I had a huge cohort. I was with 9 new grads when I started, so we all kind of became pretty close, and on that regard it was good. So we were kind of all in it together, because we're just thrown in and figured it out. So I always work night shift, but I love night shift. I think that's less people like night shift, but I've always liked night shift. I have no issue. I think sometimes people find it difficult to translate that into a normal lifestyle, and their sleep schedule gets all screwed up, and that's definitely true, and it's probably really bad for my body, but I flip-flop kind of just fine. And during the day, all the teams will round, and it's just team after team after team, and it is hard to get everything that you need to get done as a nurse, and then also have all these teams come by, which are very important as well for the patient's clinical plan. But during night shift is also nice, because the providers that I work with, it is slower, and they're super open to talking and teaching, and if you have any questions, you can pick their brain and just sit there, and they love to just come and geek out if you seek that out with them. Whereas day shift is so busy, and there's residents all over the place, and there's not as much time to sit and just talk to providers and learn from their perspective. And that was also another piece of advice that I got, was ask the providers from their perspective, what do I need to know as a nurse? What do you think that I'm not doing, or I could get better at, or information that is better to that would help me learn more. So I think in the aspect of an emotional toll, I think I'm pretty good at leaving work at work. I see horrible things all the time, and I see really good things all the time. I've seen patients walk out of the ICU, and that on their own 2 feet, which is amazing. And that's always a great feeling as a nurse, to see your patient be able to do that. But I think in that regard, I can compartmentalize, but sometimes the residual anxiety of just oh my gosh, that was just so much. I don't even know what the doctor was talking about when they were asking me that, and could I have done this better? Or I don't know, I kind of didn't know how to answer that. Just that residual anxiety, I think I can take home with me sometimes. Or I don't get as nervous before shifts now. Walking into work, I don't feel I don't know, the first few weeks I was oh my gosh, I don't know if I'm going to be able to do this. I don't know. What if they give me something I can't handle? But I don't really feel that as much anymore. But I think in that regard, I sometimes can take that home with me. But I think it gets better as time goes on and I get better at what I do. Yeah, for sure. Well, I definitely feel like it's impossible in, just the time of orientation to experience every emergency that you'll ever experience. And I do remember on orientation, I did have one of the patients we had coded. And that's, I just sort of took a step back because my preceptor jumped in and she got him back, which was great. But in that scenario, I was toast. I didn't know what to do. And the patient would have been toast too. But then I got to see it, and I feel like the next time I could sort of jump in, and then the next time I'm even more familiar, and the next time I'm like, okay, I so got this. Yes, but I think if you were to ask me of any of the memories that stick out, it comes back to like the moment that you you have made a difference in your patient's life or your patient's family members. And I think if you were to, like, I've been asked before, like, what's the most rewarding part of the job that you have? It's when like the family members say you actually made a difference, or like you made this experience so much better. So, I mean, I remember I was caring for a patient who was a failed suicide and had a traumatic brain injury from that. And this patient's family member was trying to get them to eat something, and they didn't want to eat. They had no appetite, which is understandable. But I asked the patient, I was like, do you like French fries? And they nodded and were like, mm-hmm. I was like, okay, you have to go have your mom go get you the curly fries from the cafeteria, and you'll love them. They're so good. And it made them smile. And even if it was like just French fries, if they were to eat something, like, that's better than nothing. But just like the fact that that gave like the family member something that they felt like they could do, and it was better than the hospital food. And to see the patient smile and something that simple, like, it's moments like that that really stick out. And it's a teaching hospital, tertiary, like level 1 trauma center. They have med flight coming in all the time. They have a huge pediatric side of the hospital. It's like its own building. So that's amazing because there's really, you can, if you seek it out, you can seek out anything. They have like fantastic departments, and the doctors are incredibly smart. They're like world renowned. So I love that. And the residency program that I'm in is fantastic. I think it's been a fantastic foundation. I actually, before I applied to the residency program, I worked with 2 nurses that had gone through it. And they were probably 6-7 years out of their residency program. But they were some of the best nurses that I've ever known. So, and when I worked, not before I was even a nurse, when I worked as a technician in the Neuro ICU, they were always teaching me things and just letting me be more hands-on. And so I knew when I was going to end up there that it would be a good spot and I'd end up okay. I was family friends with Ashley, so we go way back. And from the first time I ever met her, she just has an infectious way about her. So she got me all excited about nursing. And I mean, I've known her before I even went to nursing school. But she got me all excited about that. And, she's like, wherever she says, this is cool, you should do it, I'm there. She's taught me, even as like a young baby nurse, that if you don't like something and if you think that there's a way to change something, do it. Like, follow it out to the end. And, every time like I think about something now, I think about it on maybe like a deeper level of like, well, why do we do it this way? And could it be done better? And, what could make this better, easier? And I think that that's important in nursing, to always be like thinking about the why. I think it's important with your patient care, and it's important with nursing cares, knowing the why. Well, why am I doing this intervention? Why is my patient's blood pressure low? Like, what's the physiological reason behind that? And then well, why is our protocol this way? What happened that made it this way? Is there any way to make it better? And I think it's important to keep that in mind with everything that you do throughout the day and all of your interactions.